just to give everybody well, welcome everybody. We're excited you're here today. Thank you, friends, for joining us from all across the country. I see we've got people from Illinois. It looks like we have someone from New Zealand. Hello, Dr. Kate. Glad you're here today. And I see folks from Texas and Arizona and all over the place. So thank you for joining us today. Very excited to introduce our guest. Before I do that, I do need to just show you a few housekeeping things so you're aware of what's going on here. Give me one moment. Okay, hopefully you can all see my screen here. Okay, so I'm Benjamin Sermi, social gerontologist. Happy to have you here today. Excited to be part of this series with you. At the bottom of your screen or the top of your screen, depending on how you use Zoom and which device you're on, there are two things you may need during this presentation. One of them is Q&A. If you have any questions during this presentation, click on Q&A, type your question in. At certain points during the presentation, Dr. Colin may ask me, hey, Benjamin, do we got any questions? I'll go there, I'll read him your questions, and he'll answer them live for you. You can also chat, especially if you need to ask me a question, you're having trouble with something, or you want to suggest something, go ahead and use the chat bar, and you can put something in. If Colin asks for, hey, how many of you like this or whatever, that's where you would go. You go to your chat bar and you would put in your answer, and I would be able to tell Colin pretty quickly, wow, this is what people are saying. So wanted you to know that. Also want to remind you, if you haven't been in our calls before, that we are giving away the first of its kind, the Caregiver's Care Package, designed by a licensed clinical family therapist. And it's a care package. She actually does a subscription where every month there's a different care package. We're going to give away 1 month, as well as a caregiver journal she created for family caregivers, people who are caring for a loved one. We are giving those away. All you got to do is at the end of this presentation, go to livingwellevents.org/insights. For most of you, it will pop up on your screen automatically. For some of you, it won't. So you'll just need to go to livingwellevents.org/insights. And I believe Dr. Colin has a video he'll be sending to anybody who goes ahead and puts their email in so they can get the video that he's going to send after this. So with that, I just want to introduce to you Dr. Colin. He has been working in this field for about over 20 years and has worked with seniors for many of those years in their homes, in retirement communities, and really, found a lot of success working with them, but also was frustrated that there was all these amazing tools, but they weren't really being implemented well. So he's actually designed, he innovated and invented some products that have been really helping seniors reduce falls and have been revolutionizing the way seniors are able to maintain their ability to stand, to dress themselves, to stay active very long in their life. Today, he's specifically going to talk about how to take care of yourself at home. So I'm going to let Dr. Colin take it from here. Dr. Colin, please go ahead and share your screen, and love to hear what you have to say today.
Great. So I need to go back to my presentation, right?
Just click share screen and it will.
Am I there?
I'm here. I can see you. You're there. I hear you.
Okay. Can you see my screen okay?
You haven't shared your screen yet. I can just see you.
Oh. Share screen. Oh. Am I there?
Not yet. Try it one more time.
Oh, now?
There we go. All right. There you go.
How's that?
Perfect.
Great. Thanks, Benjamin. I appreciate it. And today I want to be clear, everybody, this is not a presentation to try to get you to buy anything. This is strictly an approach that anybody can use. Now, there are some tools that you may find that might make your job easier as a caregiver, or depending on what you do. But that's what makes this particularly difficult for me, because when I do presentations, I like to be really interactive with my audience. So if you have questions, please don't hesitate to type them in, and I'm going to be stopping periodically so that so we can address those. Okay, I really want to hear from you. I'm really curious to see what you guys think and what questions you have. So I'm going to go pretty quickly, but I will stop periodically. And as Benjamin said, I've been practicing for almost 20 years. I actually owned my own physical therapy company. I own several clinics that I just sold last year. So now I'm focusing 100% on geriatrics, and really what I learned the last 20 years and applying that to how I can help older adults mostly, and also caregivers to make this make your jobs a lot easier. My grandmother, actually, she died because she sat too long. This was many years ago, and it was pretty traumatic just because I knew it was preventable. And one of my life's missions is to make it so that other older adults don't suffer that same fate. And so anyway, I invented S3 Balance in 1997. It looks like that for those of you who haven't seen it. And again, this is not an infomercial for S3. This is just one of many tools that you can use, and you don't have to have any equipment, okay? This just makes it easier. But I've worked with assisted living, memory care, independent living, and skilled nursing and rehab communities all over the country. And I know how hard it is to get people up. So really older adults, seniors, kids and animals, they're all part of a very vulnerable, they're all vulnerable groups. And if we don't care enough to really look out for them, they're really at risk. And I just have to ask this: what would you say to a dog owner? Okay, this is just, I want to go over a cultural philosophical approach, if I may. What would you say to a dog owner if that dog was kept in bed all day long, never got any activity, didn't get to interact with other dogs? Would you have something to say? Because the dog might look something like that. And that's actually our dog. And she makes this face when she smells nail polish remover. So she's not angry, she's just reacting to that smell. But anyway, the point is, would you have something to say to that owner? Because that's being irresponsible as a dog owner. Same thing if you're a parent. If you know a parent of a child who all they do is play video games all day, they don't get any activity, they eat mostly junk food, if they're antisocial, and they expect the parent to do everything for her or him, that's something that is a big problem in this country now. So what we're looking at is what makes an exceptional parent, what makes an exceptional dog owner. I mean, this is a very consistent theme that we're going to take into the topic of today, which is, being altruistic, health conscious, being compassionate, loving, really being supportive. And if there's an issue, having a healthy redirection rather than scolding, and really being motivational, getting people to understand how important it is to get up, because life comes full circle. This is actually my grandmother and my son back in 2007 after he was born. And how we treat older adults in this country, I think it is getting better, but we have a long way to go. We treat babies a lot better than we do older adults. And so my goal is to make it so that we treat older adults how they should be treated, a lot like babies. They need a lot of help. They need a lot of love. They need a lot of care, and they need us to care. And so the question is, what makes an exceptional caregiver? What makes an exceptional senior living community? And my argument is that it's really the same things. As a dog owner, as a parent, these are consistent things that we need to have in this field if we're gonna protect seniors. So with that said, now we're getting into kind of the meat and potatoes here, because how many of you are aware that what's listed there, early death, DVTs, census problems, all the way down to COPD, these are issues with smoking, right? But these have also been linked to prolonged sitting, along with all of these. So as Dr. Levine put it from the Mayo Clinic, he said that sitting is this new smoking. It kills more people than smoking. And along with all these other things, this is sitting, people. This is sitting on average more than 6 to 8 hours a day leads to all of these issues. And sarcopenia, by the way, that's muscle wasting. And IDDM is type 2 diabetes. COPD is chronic obstructive pulmonary disease. And CAD is just coronary artery disease. So you can make the argument that prolonged sitting or inactivity is more lethal and carries more problems than smoking. And standing balance training. So if you're looking at a way to really turn this tide, you're looking at doing standing balance exercise, which can do all of these things, right? Reduces fall risk, can reduce back pain, it improves immune function. We're going to talk about that in a minute. Hormone release, all the systems for balance. And the census down there in the bottom right-hand corner, a lot of the communities fight census problems. They're like, what can we do to get more people in? And the answer, actually, not surprisingly, lies in taking better care of the residents that you have. Studies have shown that if you implement wellness programs that implement especially standing balance training, that you can increase average length of stay 400%. And it's worth hundreds of thousands a year. So now sitting activity is very common. This is what you see a lot of times in communities, which improves sitting balance, right? It improves sitting endurance, upper extremity strength and range of motion, and socialization. But most of all, it really gives a lot of comfort to the administrators because it offers something, it's something that they can say, well, yeah, we offer activity. We offer activities to our residents, but there's no evidence to suggest that it improves balance and reduces falls. You've got to combine it with something having to do with standing training. So when we talk about the immune system and using exercise, we measure that. So how do we know if exercise, if whatever it is that we're doing, how do we know if it does improve the immune system? And it's measured by looking at natural killer cells. That's what the NKCs are, neutrophils and macrophages. And the neutrophils and macrophages, they're just white blood cells, but the natural killer cells consistently have shown an improvement when you implement standing activity with the proper intensity. This is extremely important. This is the key here. So if you're looking at intensity of exercise, now this is predicated on the idea that it is in standing, not sitting. And you go from 0 to 10 where the person is working maximum, where they feel like they're going to pass out, all the way down to nothing, which is where we're all at now. We're just sitting down. And what research shows out of the 5,000 plus papers that have been done in the last 20, 30 years is that moderate to strong activity likely, and has been shown consistently, to enhance immune system function by increasing natural killer cells, neutrophils and macrophages, but especially the natural killer cells. But in doing that, it's not a very intense exercise. It's more moderate to strong, which is that 3 to 5 range. On the other hand, if you go too intensely, so if you really push, and we see that in really heavy duty athletes, where they train too hard or not at all, that's been shown to reduce immune system function. So we're looking for a happy medium here. And if you look at something comparable to COVID-19, you look at HIV. And HIV, for many years, they thought, well, exercise doesn't really do anything for immune function, but it does improve depression, symptoms related to depression, independence, improves independence, quality of life, and cognition. But for many years, they said that it doesn't really improve immune system function. And more recently, the last 10 years, they've shown it actually does. It can actually improve the function of the immune system. And the same goes for older adults, but you want to get the intensity right. That is so crucial here. And I'm going to be talking about how to get that with the people that you work with. But it requires a cultural shift, because currently in all the communities, well, not all of them, but the majority of them, this is what we currently see. Don't move, we'll take care of you. You're being nice, I get it. But the new philosophy, the shift that we need to move toward, if we're going to take better care of people, it goes back to the philosophical approach that I talked about earlier, is that you got to move, but we'll keep you safe. I'll do that for you. That turns into, you give it a try and I'm going to watch you. Are you 100% comfortable? Which is a nice thing to say, but it's still, the better question is, when are you exercising today? The other problem with this approach is that staff, a lot of times they'll say, well, I don't want the residents to do everything because then I look like I'm not doing anything. But what happens is when you adopt this, that the staff becomes more empowered. So the residents start to improve their function, which is reducing strain on staff. And instead of the sterile environment, which is, I get it, we want to have a clean environment. Rather than just sterile where everything is prim and proper, you have a clean but functional environment where things are set up to help residents where they're going to have to move more. And the second piece is to educate them. How many people in here brush your teeth? Yeah, well, I should hope most people. Well, why do you brush your teeth? This is a motivational technique I use with seniors. Well, why do you brush your teeth? And they laugh and they say, well, because I don't want my teeth to fall out. Okay, do you balance train every day? And most of them say, no. And I said, well, so why not? What's going to happen to your balance if you don't use it? And the answer becomes obvious, and it is obvious, but a lot of people don't appreciate that if you don't do standing balance training, you lose it. It goes away. You can do as much sitting stuff as you want. You've got to stand. But most importantly, the quads and the glutes. When we get into the programming piece, you're going to see a lot of it is based on those two muscle groups. Because time and time again, when it comes to preventing falls, even boosting immune system function, these muscle groups are so large and so critical to function that we really need to emphasize those in every program that we have. But really, it comes down to showing compassion, getting people up and communicating using things like, this is Humanitude's mantra, which is gaze, you make good eye contact at first, make sure that they can see that you care. You give a light touch to the arm, and your tone is a loving tone. It's one that shows you are here to help them. And I just abbreviate that as GT squared. I'm going to use that a couple more times. But you can see here with this video, this woman, she was a judge, and she requires 3 people to get her up. And what she's doing, I want you to watch her face when she gets up on her own. She's not getting any help. And Daryl, the gentleman there that's helping her, he's going to coax her into giving him a hug. And watch her face. And you know why she's making that face is because she's doing it on her own. And she's leaning forward. Now, you can do this on your own. You don't need to have S3. Of course, it makes it easier, but you don't need to have it. The point is, the more that residents do on their own, with your facilitation through caring, tone, and giving them the right cues, it's pretty amazing the changes that you can make. Okay, so now they're up. Now what do we do? And this is where it gets pretty interesting. We got to know some exercise science here, folks. And for this, the rate of perceived exertion, I hope you've heard of this, but all it is, it's a scale. It's that scale that I alluded to earlier, 0 to 10. There are actually 3 scales. I use the 0 to 10 for simplicity. And again, it's 0 to 10, but we've got to get a little bit more detailed here. So 1 is very light, 2 is light, 3 is moderate, 4 moderately strong, all the way up to 7, which is very strong. So when it comes to adaptation, so whatever it is you're trying to do, if you're trying to boost immune system, if you're trying to improve strength, flexibility, balance, any endurance, all that, it depends on this scale. And you've got to know it, and you got to know how to apply it, because the degree to which a person is going to improve, whatever it is you're after, it depends on that level of difficulty. So when you're talking about really getting boosts with balance and strength and those types of things, the moderate to light will not cut it. It will, however, slow disease progression. So just getting up is hard for some people. So you're getting, 3 to 4 or 5, but it's, we really want to start pushing people gradually as we go along. And what I call that is the wobble. So when they get up, they are actually challenged to the point where they wobble a little bit. And that is going to facilitate more dramatic improvements in balance and strength. If they're completely still, they're not really challenging their balance. What you might be doing is challenging their strength, because it's hard for them to stand up because they're so deconditioned. But when it comes to the 4 balance systems, you got to have it where they're actually challenging all balance systems and having that wobble. So what you're trying to do, especially during this pandemic, is you're going to be working in that 4 to 5 range, at least initially, because the deconditioning is happening in an extreme way, and it's happening every day. So you got to be careful. But my point is this: try to get them around a 4 to a 5 consistently every day. And what will happen is they're going to adapt to that. And then what's going to happen is that activity will actually turn into a 2 or a 3, and then you got to progress them. But at least this way, you have some way to attach some objectivity to making sure you're not overdoing it or underdoing it. And that depends on this. So the science about this, and I don't want you just to do this because Colin said so, okay? So this is the science of what I'm talking about, and it's based on something called torque. And it's a rotational force. So what I want everybody to do, go ahead and sit up tall and put your arms straight out to the side. Okay, just one arm, it doesn't matter which one. Okay, now holding your arms straight out to the side, you'll notice that's not too hard. Well, the axis, so the torque, there's actually torque right now on your shoulder. The axis is your shoulder joint, okay? And that's what I'm pointing out now in the picture. The lever arm is your entire arm. Now she's holding a dumbbell. I don't think you're holding a dumbbell. If you are, you're pretty dedicated. But if you're holding arms straight out, that's the lever arm. Now I'm going to ask you, if torque is force times lever arm, what can you do sitting there? You know, the longer you hold that, that's going to get tired, right? So what can you do to make that easy right now? You can bend your elbow. So just bend your elbow. And what you're going to notice is, boy, that's a lot easier to hold. It's because when you maximize torque or that rotational force, you also maximize work of the muscles that are holding you in that position. In this case, it's your shoulder. So now what we're going to do, we're going to have Tawny, she's the model there. She's going to lie on her side. Okay, now we're going to get into the balance piece and the immune system piece. So now let's say she's lying on her side. Now the axis is the same, but the lever arm is dramatically different. So now with the force going straight down through her arm, the lever arm is 0. And you can do that if you were to lie on your side and hold your arm straight up. It's very easy because gravity is going right through your arm. There's no lever arm there. It's extremely short. But if Tawny decides to abduct a little bit or raise her arm up, you can see the lever arm, now it increases. Now the muscles, well, they're having to do a little bit of work relative to gravity, right? Same thing if she adducts. So if he brings her arm down a little bit, it increases the lever arm that way. So the mechanics of the wobble, let's look at that. Don't forget that, because now we're going to apply that and you're going to see a video here. So if you have a person with a not so great physique here, there's the axis is their feet. They're anchored to the ground, and there's the midline. The lever arm is 0. And you guys know this already. Just standing there is not, that's the easiest thing to do, right? But the problem is when you start to lean, so if you go to one side, now there's a lever arm that comes out. Because now it's like, okay, now gravity is doing more work on my body because now there's a displacement from the axis. Same thing if I go the other way. So if I lean the other way, now I've got a lever arm going the other way. Understand? So if you see that in action, now let's say, now this is S3. This can also happen. I'm going to show this manually with hands out, but you can see this is why it's so critical to have balance on both sides. She's touching each side of the bar. So whatever it is that you're going to have people do, you need to either hold out your arms or use parallel bars or something so that you can spot on both sides. What that does is it checks the torque in all those planes. Okay, and she's doing a great job. Now look at this woman who really struggles. See how high her hands are? It's because she's not able to overcome that torque. And the torque is going it's in multiple places through her knees or hips, but our reference point is her feet. You can see how easy it is for her to go over because we have torque here in 3 planes. She's in free space. So seeing the central nervous system, it has to be active in 3 planes, and the muscles have to work in 3 planes. So you got to have both hands and you got to have them very close. See how high she's raising her hands up? You got to have the hands very close so you can very gently spot whatever it is that you're touching. So watch this manual piece. So watch the spotter's hands. So she's doing this. Now she's going to close her eyes and watch. She almost loses it. And the reason why she almost loses it is because her spotter doesn't have stiff arms. So we call that neural grounding. I'll get to that in a minute, but you got it in order to be oriented in space. She's going to be a little stiffer and she's going to touch. See, now she has that feedback. So it's based on training all 4 balance systems: vestibular, which is inner ear; visual, somatosensory, which is proprioception is one of them; the muscular system, and then also developing power, which I had to mention, but that's going to be a whole other presentation there. But all this adds up to making sure that you have a stable reference point, and that's called neural grounding. The brain, when you touch something, when I touch something, it goes through the brainstem into the cerebellum for processing, and that's what gives you those learned automatic movements so that you don't even have to think about it. What also happens is the cerebral cortex, it processes that so that now you can actually plan for next time. And all of that happens just through touch. You don't have to grab, okay? So you have 3 choices. You get manual assistance with stiff arms. You got to have stiff arms, and that's where you induce that little bit of a wobble, okay? But make sure that your arms are stiff. Again, it's got to be a reference to earth. It's got to be stable. You can also use parallel bars. You can use S3 with a wobble again, or you can use an immovable surface and you're not going to get a wobble. But by no means do not use a chair. It's too high risk. And if you are going to use a chair, you really shouldn't have any wobble in the first place because it is just too high risk. But no more chairs for standing activity. The number of cases, the number of injuries, they keep going up with chair activity. With places they keep trying to do balance training with chairs, and to get any kind of balance to challenge to balance, you can't do that with a chair. It's just too high risk. They tip over. So the suggested program here, and this is what we'll send you a link to. You can use, this is actually my mom. She's doing a tandem or the tightrope. She's just using the counter here. Now, bear in mind, she's not getting any wobble here, right? Because look, her hands are too far in front of her. It needs to be more to the side. But what this does is for your very low level people, just getting up and interrupting that devastating sitting cycle. This will slow the disease process. It's not really going to give you a big tip in balance improvement, but what it will do is just really stop that daily, really steep decline in function. So there's tandem, which is more hip and quad, right? There's also the big step, which again, picture your arms being out. She's using S3, but you can use it where you can just barely touch and you can get a wobble, okay? Or no wobble. It just depends on what you're using for assistance, but you got to use something. The squat you can use for a kitchen counter. And with this, look at the position. I really want to stress two things here. Look at the depth that she's squatting. So she's squatting, you can see it's a 50 degrees of knee bend there. Don't have people squat deeper than this, even if they can. The research is very clear on this. It's one of the few things that's very black and white. When you go deeper than 50 degrees of knee bend in closed chain, this is a closed chain movement, the forces on the kneecap skyrocket. So even if they can go deeper than this, please do not have them go deeper. And so that's one. And then the second thing is look at the position of her hips. They're behind the heels. So she's not, her knees, if they went forward, they would actually bump the cupboards there. You see that? So she's staying back on her heels. And then, well, okay, there's a third thing. She's not arching her back, okay? This is actually really hard to do for most people, even people that train. And then the other one is foot up. And you can use anything. Again, she's using, this is a woman in memory care, and she's putting a foot up there on the bar, on the crossbar for S3. You can use a small stool. You can even use for really low level people, just use something, anything solid, even just a small shoebox or something, where just putting their foot up, because that's what gait is. You have to be able to support your entire body weight for a split second during gait with one leg. So that's a great move. And again, you can progress from a closed grip. So if they're grabbing your arm or whatever it is, they got a full grasp. Okay, that's the easiest. And you're not going to get much improvement with balance with this. You progress that to an open grip, which is where the fingers are open, as you can see. So now we're progressing to the floating grip. Now the floating grip, just whatever it is, if that's your arm there, or whatever it is, you want to make sure that they stay within an inch of your hand. That way they can't get enough inertia. Remember the torque example that I gave you? They're not going to be able to tip very far at all before they self-spot to activate go through the cerebellum and the cerebral cortex. I hope that makes sense. If they keep their hands up or down, that's very dangerous, because now they can get a lot of inertia. They can actually go over too much, and then it's too late, and then they can fall, okay? The next progression is eyes closed, and pretty much all older adults hate that. And the reason why they do is because when you close the eyes, you've got to use the other three balance systems a lot more. So proprioception, muscles, and the vestibular system, you have to use all of those a lot more. And usually they have a vestibular impairment. So when do most adults fall? It's usually at night because they can't see. So I really encourage you to progress to where they are closing their eyes, because that forces those other three balance systems to improve so that they have more protection, especially at night. And then lastly is looking up. What that does is it disorients the vestibular system. So now it becomes that on top of closing the eyes, that's really tough. So lastly, the motivational strategies, I've got 3 of them. The one thing that that really tends to ring true with older adults is loss of independence. If you don't do this, it's your choice but you will lose independence. You are going to have to rely on other people, and you will die early. If you do not get up and make it a regular routine of your life, you're not going to live as long, and you are going to lose the ability to do what you love to do. You can also create a log and then forward that to whoever is most important to that person at that time. So family members, doctors, friends, whoever, some way to hold them accountable so that they know if it's not enough for them to do it for themselves, if that doesn't motivate them, but they don't want Dr. Myers to know, that they're skipping. You got to find out who's really important to them, and then say, I'm going to forward that log. I'm going to forward your exercise log to them so that they can applaud you and hold you accountable. The other one is a functional reach test. Now, a lot of people, we use this to show improvements in balance for S3, and we've used it a lot in the clinic. And for those of you who haven't seen this before, that's a ruler that's attached to the wall, and you don't need to do this. You can actually just use a tape measure, and you can manually do it and just stand there. And what she's going to do is, she stands shoulder width apart with her with her shoulder flexed 90 degrees, and then I say, okay, go, and she leans as far forward as she can without moving her feet. And then all you do is you record the starting and the ending, and you do it 3 times, and then you throw out the first one, and then you average those last 2. And then that gives you that person's functional reach test for that day. The benchmark for that test is 7 inches. So if they can't go at least 7 inches, they have what we call extremely high fall risk. It's not if they're going to fall, it's when. So it's a great way to motivate them, but also to give you some objective data. Anyway, I'm sorry that I should have asked. I just kept going on there. I should have asked, are there any questions? I'm sorry. Benjamin, anybody have any questions?
Yeah, does anybody have any questions? You can either raise your hand or chat. Let's see here. We got one coming in here. Hold on a second. Dr. Kate Riegel from New Zealand says, thank you so much, Colin. Very informative presentation. Practical tips rooted in excellent science and evidence. Really enjoyed it, but no questions. Dr. Kate is going to be presenting later this month on her work with the Maori practice of poi and how it helps with balance and grip and attention. So you might enjoy being on her presentation, Dr. Colin. Any other questions from anyone? I know while we're waiting, I have a comment. Maybe you can address this, Dr. Colin. I've always been on the impression that what you had to do to make any progress is fairly complicated. And I mean, it involves a lot of stretching and moving and this and that. What you showed us today, you can do at home at the kitchen counter with a friend stretching out their hands, and it looks like it takes no more than about 10 minutes. And that can help you at least maintain some sort of level. Is that what I'm hearing you say?
The key right now, it depends on where you're starting from, but right now with the isolation, I can't stress this enough. People need a way to get up. Just getting up, a few times a day, using kitchen counter, using caregiver, it doesn't, honestly, it really doesn't matter. Let's not go for major improvements right now. Let's save lives, because preventing the contraction of COVID-19 is only half the battle. What people are forgetting right now is that the farther we go along, and you're going to see this in 2 to 3 months, especially in the older adult communities, for those that were neglected, that did not get up regularly, you're going to have more falls. You're going to have disease progression, the diabetes. They're going to have complications, osteoporosis, chronic pain. You're going to see all of these things happening because we forgot the other half of this battle, which is you've got to take care of this vulnerable population. If they don't get up, and I mean on a daily basis, it's just like brushing your teeth, you're going to run into problems. So really, let's just focus on getting them up, using the counter program. It'll work, it'll tide them over. But then just in your mind, you want to be thinking, okay, now what? We need to progress them into balance training and being more aggressive and really going for a wobble, so that the central nervous system, so everything has to work harder to right them. We call it writing, for them to stand up and maintain balance.
I got a comment from one of your colleagues. I don't have their name, sorry, but they thanked you for explaining how important 50 degrees are when you're doing your squatting.
Yeah.
Yeah.
Yeah, and if I violated that rule for many years in bodybuilding and drug-free bodybuilding. I went, we were taught, got to go parallel to the floor, I mean, and that still exists today, but the research pretty much gives you the finger on that one and says, well, you can, but you're going to destroy your knees. And it's very succinct. It shows that the contact area between the patella, your kneecap, and the femur, it drops considerably. It goes way down. And pressure equals force over area. So when contact area goes down, pressure goes way up. And all the models show the same thing. You get to around 50 or 60 degrees and the pressure on the knees skyrockets.
Wow. Hey, I know a lot of folks have to head out. Could you just tell them about this 10-minute video that we'll be sending them if they fill out the form?
Yeah, so the video, it's complimentary, it's through s3balance.com, but it takes anywhere between 6 to 10 minutes to do. But I really recommend going through with your clients so that they can do it several times a day. And it's just that the squat, the tandem, there's actually a modified push-up off the counter. But what all those exercises, what all those movements do is it's a comprehensive from head to toe. It gets all muscle groups. And the more they do it, the better off they're going to be. And again, it's not designed to be particularly challenging. All it is a disruption in the catastrophic continuation of sitting. And please email me. You saw my email there. Just if you have any questions, our job is to make your job easier and make it so that we can help these people.
We'll make sure we include the email for you along with the video. And that goes out to everybody who goes and fills out this little questionnaire so we know who wants the information. We'll make sure to get that to everybody.
Okay.
Hey, thanks so much for being here today. And I really appreciate your mission to help seniors who might otherwise not be getting this information and care professionals who may not be realizing how detrimental sitting is. Thank you. I really appreciate it.
Thank you, everybody. Thank you.
Talk soon.
Bye-bye.
Oh, I should say one more thing real quick. Next week, we have 10 dementia-friendly online activities on Tuesday evening. And then Thursday, we have Pam Brandon with Educate, who is going to be sharing about how to really inspire reminiscing at home when you're at home and nothing to do, some really great reminiscing tools. So we'll see you then. Talk to you later. Bye-bye.
Thank you. Bye.